Assalamu alaikum. Now I would like to discuss about renal tubular defects. First of all, Fanconi syndrome. Fanconi syndrome. Fanconi syndrome occurs in proximal convoluted tubule. What happens in Fanconi syndrome? There is generalized reabsorption defect in the proximal convoluted tubule, and the proximal convoluted tubule. What are the things reabsorbed by the proximal convoluted tubule that becomes excreted? Like excretion of glucose, amino acid, bicarbonate, and all the substance that is reabsorbed by the proximal convoluted tubule. In here there is metabolic acidosis. In here there is metabolic acidosis, hypophosphatemia, and osteopenia. In here there is metabolic acidosis, hypophosphatemia, and osteopenia. And the causes include hereditary. In hereditary cause there is Wilson disease. In Wilson disease there is problem in copper. There is tyrosinemia. There is tyrosinemia. There is glycogen storage disease. And the other causes include there is multiple myeloma. There is nephrotoxic drug like ifosfamide, and cisplatin and lead. Okay, the causes include Wilson disease, tyrosinemia, ischemia, multiple myeloma, and other nephrotoxic drug like ifosfamide, cisplatin, and lead. Then next is Bartter syndrome. This is the location where Bartter syndrome actually happens. That means thick ascending limb of loop of Henle. Okay, can you recall that what happens in thick ascending limb of loop of Henle? In thick ascending limb of loop of Henle, the drugs acting on the thick ascending limb of loop. Can you tell me the name of the drug? What works on thick ascending limb of loop of Henle? This is furosemide. Furosemide is the drug which works on thick ascending limb of loop of Henle. It inhibits sodium, potassium, and 2-chloride channel in the loop diuretics. Inhibit sodium potassium 2-chloride channel, and the Bartter is there is reabsorption defect. In tull. So it will affect the sodium potassium 2-chloride co-transporter. In here there is metabolic alkalosis, hypokalemia. In here there is alkalosis, hypokalemia. In here there is alkalosis. Hypokalemia. In here there is alkalosis. Hypokalemia and hypercalciuria. In here there is hypokalemia, hypercalciuria, and hypokalemia. Causes include it may lead to stone. This Bartter syndrome can lead to formation of stone, and it is autosomal recessive. So What are the things you have to remember in barter? In barter there is reabsorption defect in sodium potassium, reabsorption defect in thick ascending loop of Henle, which affects the sodium potassium 2 chloride. In here there is metabolic alkalosis, hypokalemia, and hypercalciuria that leads to stone. Hypercalciuria that leads to stone. This is the Gittelman, and Gittelman, the location is DCT, and in distal convoluted tubule there is reabsorption defect of sodium chloride in DCT. Reabsorption defect of sodium chloride in DCT. There is metabolic alkalosis. There is metabolic alkalosis. There is metabolic alkalosis hypokalemia. There is metabolic alkalosis hypokalemia, and also there is hypocalciuria. There is metabolic acidosis, hypokalemia, and hypocalciuria. It is also autosomal recessive, and in here the drugs the drugs actually acts in these DCT is thiazide diuretics. It presents similarly to lifelong thiazide diuretic use, and it is less similar than Bartter syndrome. And now Liddle syndrome. What happens in Liddle syndrome? In here there is gain of mutation. In Liddle syndrome there is gain of mutation, so there is increased activity of sodium channel. There is increased activity of this sodium channel and increased reabsorption, and there is increased reabsorption in the collecting tubule. In here there is metabolic alkalosis, hypokalemia, but there is hypertension and low aldosterone. There is hypertension and low aldosterone. This is high L. That in Liddle syndrome there is hypertension and low aldosterone, and it is autosomal dominant, and it presents similarly to hyperaldosteronism, but aldosterone is nearly undetectable. It may be treated with amiloride. And there is another syndrome called SAME, syndrome of apparent mineralocorticoid excess. In here there is 11 beta HSG converts cortisol to cortisone. So there is in SAME there is decreased serum aldosterone level. You have to remember that in SAME there is decreased serum aldosterone level, and it is also autosomal recessive, and it can acquire disorder from glycoroenitic acid like licorice, and it may be treated with potassium sparing diuretics. And that's all for renal tubular defects. Inshallah you will be benefited.